Hi there, it's Kathy and Melissa from Institute for Pelvic Health.
And you are watching Demystifying the Pelvic Floor, weekly videos providing real and simplified pelvic floor education for real clinical situations. We've got you covered.
In this video, you'll gain insights into the benefits of pelvic floor therapy for women and why you should consider it for your patients. So generally, a pelvic floor treatment at our clinic in Boston at Wellist Integrative Health, we are lucky enough to have 55-minute appointments, which is not always the case, and this can totally be done in shorter treatment time. We use a holistic approach, which includes not only the internal assessment, but also external assessment and treatment to improve postural alignment.
As a nurse practitioner, I am used to much shorter sessions, somewhere between 15 and 30 minutes. So, a pelvic floor therapy session will include an extensive review of your past medical history, a comprehensive postural assessment, and then external hands-on techniques to help with pelvic alignment and balance. We'll also work internally, either vaginally or rectally, depending on the condition. For the internal work, we use one gloved finger with lubricant, and we're assessing the pelvic floor muscles. We're assessing for pelvic floor strength, the ability of the pelvic floor muscles to relax, skin integrity, and we're looking for areas of tightness or tone that are contributing to your patient's symptoms. Internal work is generally not performed for more than 30 minutes of a 55-minute session, as these are muscles like any other muscles in the body, and they too can become fatigued or irritated if worked on for too long.
We also build a home exercise program that includes like foam roller exercises, ball work, whether they need a dilator for internal work, a vaginal moisturization routine, education, and more.
So share with your patients what a pelvic floor therapy session will be like so that they will know what to expect when they get to us. And consider pelvic floor therapy for your patients with pelvic pain, dyspareunia, overactive bladder, urinary or fecal incontinence, vulvodynia, vaginismus, prolapse, unexplained vaginitis, vaginal or rectal burning, constipation, or any other thing that you think might be pelvic floor related. We can help.
And think about a referral to pelvic floor therapy when ruling in or out urinary, bowel, sexual dysfunction, as it's very easy for us to do a quick evaluation to see if a patient would benefit. And please see below the video for resources for finding a pelvic floor therapist. We've listed a couple reputable sources. And that's a wrap. Did you like this video? If so, hit like and subscribe. Please share with your colleagues.
And subscribe to our email list at instituteforpelvichealth.com to get your free guide, 4 tips for managing your challenging pelvic exam. You'll get access to our weekly pelvic health content.
And be sure to find us on Instagram, Facebook, and LinkedIn, where we'll post more pelvic health tips. We're super excited to announce we're also developing an online pelvic health course for nurse practitioners.
Our course will break down the pelvic floor so that you can confidently care for your patients with pelvic floor dysfunction. By simplifying the pelvic floor, we'll improve patient outcomes and your provider experience. Thanks for watching and spreading the word. Let's revolutionize pelvic health. We'll see you soon.